Good morning and welcome to our UBC Learning Circle, Indigenous Peoples' Experience and Realities within Canadian Healthcare System. What's the impact on health outcomes? Today's conversation is presented in partnership with the Centre for Excellence in Indigenous Health. We'd like to thank the First Nations Health Authority for generously funding the UBC Learning Circle and allowing us to have these conversations. Before we formally begin, I'd like to acknowledge with respect and gratitude that I'm joining you from the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Please feel free to introduce yourselves and the nation you're calling in from in the chat box. For those of you who don't know me, my name is Sarain Squawkin. I'm the Learning Circle manager. I'm Syilx Okanagan on my mother's side and Hickory Apache and Belgian on my father's side. I'll be your moderator for today's discussion. Joining us today, working behind the scenes, is Cynthia, our production coordinator. She'll be in the background interacting with everyone in the chat. And finally, before we get into today's discussion, I'll provide a gentle heads up that the topics covered may be sensitive or emotionally triggering. Please make sure that you're looking after yourself. If at any point in time you feel like you need to talk to a friend, elder, counselor, or family member, don't hesitate to do so. We have some prompts in the chat if you need additional support. Now I'll turn it over to our panelists to introduce themselves. Carmen?
Hello, everybody. I am calling in from Tsawwassen First Nations today. My name is Carmen McLaughlin. I am Saisi Dene on my father's side, and my mom is from Italy. I've had a long kind of job opportunities to work in the downtown east side. In the past couple of years, I worked as an Indigenous patient liaison in various hospitals such as St. Paul's, St. Joseph's, VCH, Lionsgate. So I'm super happy to be here. And yeah, Jay.
Good morning. My name is JD Curry, and I am from Treaty 6 Territory. I am Piikani Blackfoot, member of the Blackfoot Confederacy in Southern Alberta, and Maskwacis Plains Cree from Central Alberta. I am a Indigenous Wellness Liaison, a social worker at St. Paul's Hospital, and I work at various sites within the Providence healthcare system. And yeah, I'm happy to be here today.
Thank you, Jay.
Sarah?
Oh, yeah, we'll pass it to Emily.
Emily.
Hi, everyone. My name is Emily Flashner. I'm Anishinaabe Ojibwe from Wasauksing First Nation. I'm an undergraduate student at UBC studying biomedical engineering, and I'm a member of the School of Biomedical Engineering Indigenous Engagement Committee. So very excited for us to have this panel today.
Yeah, and Emily, did you want to introduce everyone to the topic?
Yeah, for sure. So as we have a global audience today, I want to address why we are hosting this panel. So in Canada, Indigenous peoples have been subject to systemic racism, and today we're going to focus on its influence in the Canadian healthcare system. Unfortunately, these health inequities are still a reality for many Indigenous peoples today, but our goal for this panel is to move forward and discuss actionable steps that we can all take. However, it is important for us to understand our history in order to do so. So we will be providing resources during the panel for those interested in further learning, but should any of our panelists want to speak more on this topic, they are most welcome.
Thank you, Emily. Cynthia, can you bring up the slides? So the first question we'll ask is, what does it look like to provide culturally safe care? And what does culturally safe care look like for you as an Indigenous person and someone working in frontline? I'll start with Carmen.
Does it look like? Well, working as an Indigenous wellness liaison, basically, like your job is to provide culturally safe care and advocate for Indigenous people in the healthcare system. So, like our day we'd always offer like a medicine tie. We had a sacred space at St. Paul's Hospital where we would smudge. At St. Paul's Hospital, we actually do a blanketing ceremony when people are admitted into the hospital. And if someone's in the ED and they really need support, we'd also blanket them down there. Having resources to elders, we do end of life care a lot, and elders would come in. Honestly, if we needed them, sometimes they'd even get it there that night. So that was like really nice to have those resources on hand. Yeah, we had like a lot of culturally safe cares, like as Indigenous patient liaisons. But one of the things that Jay and I noticed is that Jay and I worked together is that like even working in at St. Paul's Hospital, like so many healthcare staff didn't know that we even existed while we were in the same hospital. So yeah, but basically the same thing I kind of just answered. Like, what does culturally safe care look like? What does culturally safe care look for you as a, I think it's look like, yeah, just like having access to traditional medicines and, yeah, I think I'll go. Jay, do you want to chime in here?
Sure. So what does it look like to provide culturally safe care? As an Indigenous wellness liaison within the Providence healthcare system, we strive to promote culturally safe care from an Indigenous perspective. In that, we first and foremost is the cultural aspect of it. The cultural aspect in regards to the medicines, the teachings, the protocols, the ways of doing and being. And also, as I've said before, it's not up to us to educate the non-Indigenous who are not familiar with culturally safe practice within the healthcare system. But we urge them to take their time to go and learn on their own how, from Indigenous sources, from Turtle Island, is what we call North America, different cultural practices from various different cultural authors, professors, because they're the ones that know what it is to be and the protocols around being culturally safe in regard to our patients. So our approach is from my perspective, our approach is it's very cultural. So when I meet the patient, it's always, you know, if they're Cree, if they're Blackfoot, I'll say okay in Blackfoot, hello, or Danse in Cree, hello. And that just makes it so much easier, and it breaks the ice because these people are very vulnerable. A lot of them, they're very what's the word I'm looking for? They feel sometimes like they don't belong. And we want to make sure, and I've always often said to them that their healthcare is just as important as anybody else's. Some of them also suffer from culture shock. They're coming from a remote community, so we're there for them. I mean, I could go on. Yeah, but that's a bit of it, right? Like how I approach cultural safety and promoting the care around it, if that makes sense.
Like, what do you think about this question? Like, what does culturally safe care look like for you as an Indigenous person, someone working in the front line? Like, I would think culturally care is honestly just like what we've been doing.
I think so, but it's also culturally safe in the how do we address them? Like how do we approach them? You know, some people, you know, they've suffered a lot from racism, marginalization. You know, they're from the downtown east side area, and they already have a deficit. They suffer from a deficit from very many different aspects of how people treat them. You know, like if they're Indigenous, racism, right? Marginalization within community. You know, I've seen it, and I'm sure you have too. You know, in the ED, how do we treat them? What are the misconceptions? You know, so I think communication in a culturally safe way, and the key is when addressing Indigenous folks, the key is education from Indigenous sources.
Thank you, Jay. Emily, do you have anything to add to the question?
Yeah, sure. So I'm not somebody who works on the front line or in any sort of healthcare center right now, but I think for me, this sort of builds off of what Jay was saying, but providing culturally safe care sort of means having a culturally safe space that you can go to where you feel like what your needs are culturally are heard, and that you can be around other people who have some knowledge on that cultural background. So even like when you're on a campus, for like as an undergraduate student, I can go to the Longhouse if I want to spend time with other people who are from a similar cultural background. So having that within healthcare can be really important in that care and treatment process.
Definitely. Like I know even just some of the work that we do here at the center is creating that space where people feel comfortable to share, whether that be tea or other cultural medicines available. I know that's one of the things that we do here at the center, and it's great to hear that that's kind of resonating with you guys as well. We'll go on to the next question. Cynthia? So our next question is, how can we prioritize someone's experience in healthcare system? So Carmen, did you want to start?
Hey, Jay, do you want to start, Jay? And I can kind of like go off what you're saying.
Okay. Let me see here. How can we prioritize someone's experience in the healthcare system first? So I would say prioritization of our Indigenous folks, and I'll speak about the Indigenous people within hospital and within the healthcare system, is approaching it from a culturally safe place. Because for the simple fact is, I think that should be in everything we do, and I would say and argue we should strive to promote a policy and procedure of cultural safety within in the Indigenous sphere of any healthcare system, whether it be in Montreal, whether it be in Toronto, Calgary, Yellowknife, Vancouver. This is what we've got to work towards. And I think prioritization of a cultural safety, just like as if you were to have a set of policies and procedures in regards to safety mechanisms for security, safety mechanisms for RNs, or we need to have this, and this has to be part of the hiring process. It has to be inserted in every part of the healthcare system within Canada, as far as I'm concerned, because if we don't prioritize it, and the approach to cultural safety regarding our Indigenous folks, then how is the mainstream ever going to learn about it and know that it's important? As the Indigenous community continues to grow within Canada, this will become more so within the next generations. So prioritizing cultural safety and the teachings of policy and procedure around that, I think, are foremost and very important, for our up and coming generations, where they don't have to suffer within or be marginalized or feel like they've been discriminated against when they go see the doctor, when they go see the emergency, when they check into the hospital for whatever care they need. I believe that should be put into policy and procedure and into government, as a law, I think.
Jay, you're like talking about like a standard of like training
exactly.
information.
How else is the mainstream going to take notice, sit up and look and say, this is very important to the Indigenous people. This is very important. And we need, this is, for me, this is how I see change in the structure within the road not being paved for us. How do we start? Where do we start? Well, the healthcare system is, everybody needs healthcare. So this is how we change the structural racism within the healthcare system within Canada. This is how we would begin.
I agree with you. I think that, you know, a document that we reference often is in plain sight, but like, I don't think that it's like standard to like have read through it or to know what's going on, especially if you're working in healthcare. Like, it's, yeah, I agree with you.
Yeah, and so that's a book that just sits there, right? How do we put that those points that people have worked on into practice?
Yeah.
How do they gain teeth, right? How do they get recognized? It's putting it in the forefront.
Yeah, I think that so many things these days are just like performative in a sense where it's like, oh, like, you know, reference this to this. Yeah, lip service. And it's like, well, what is actually happening? You know, like I know it's a lot of work making that like a policy and procedure or like training that is like mandatory to take when you're working in healthcare systems, but it's like seems to be like so much like there's already things kind of in place, but I feel like everything's like volunteer. Like I know that BCH has like cultural safety training and I think it's like hummingbird training, but for some reason I think it's volunteer. So no, I agree with you. I think more things need to be mandatory.
If this is true reconciliation and we want to put our money where our mouth is, then this is what we have to do. We have to implement this, and this has to be priority for even the Prime Minister. Everybody. You know, when they're going to, you know, when he's thinking, okay, so we got to implement this, right? We got to implement these rules, these into law, you know. He talks about reconciliation. Well, start from the top. Give it to your ministers. Implement it into the procedures of the labor within Canada, the labor. Yeah. So.
Thank you, Jay. Emily,
labor standard.
Carmen, do you have anything else to add, Emily?
I think they covered a lot of it. I think a big part of bringing this into action is also just making space for Indigenous peoples as part of this process and design. I think that's overlooked quite a bit. And obviously, we can't speak for everyone's experience, even as like Indigenous peoples, we don't speak for other Indigenous peoples within Canada. So making sure that we have some way to incorporate different cultures within this process of how we form this system and how we move forward is really important. And taking steps to do that is crucial for the future.
I totally agree with that. You know, like we would probably, to implement these into law from the federal government, we would have to have, you know, consultation from every corner of Turtle Island for our Indigenous folks. It's important that we get the elders, the young, the youth. The youth are so impressionable, you know, and you're so right about that. You know, we have to like come into my teepee. You know, we have to include everybody and everybody's experiences and what would work for everybody in a generalized format that we could present to the government. I agree with that.
Thank you. If you guys have anything else to add, we can add that now, or you guys want to move on to the next question? Yep. Okay. Next question, Cynthia. Okay. Our next question is, what are some tools or tips that future biomedical or just medical students can bring to their practice moving forward to provide culturally safe care? Are there any resources that people can mention? How do you tackle making assumptions for a person who is Indigenous or not?
Who did you want to go? Oh, okay. Okay. So I'm going to answer the last point there. And then I'll go from there. So how do you tackle making assumptions for if a person is Indigenous or not? So as an Indigenous person, I usually know that, you know, a person is Indigenous, Métis, or Inuit. I mean, that's just me. But in regards to assumptions, I I will say something. One of my older bosses had told me, and this sticks with me, is never assume anything, right? Um, Always understanding people's ways of being doing is so important. And when you assume that they're Indigenous or you assume that they're non-Indigenous, in your mind, you know, we approach them in a different manner. It's just the way it is, you know. So when you don't assume that they're anything, and then if they come to you and say that I'm Indigenous, then you say, okay, well, what works for you? If I were non-Indigenous, I would say, what do you feel that would? How can we help you? How can as you being an Indigenous person, since they told you they're Indigenous, how can we help you? How can we meet you where you're at in regards to cultural safety? How can we uh, be humble and willing to learn and to listen? Because a lot of the times people don't listen to what people need, and they assume, oh, they're this way, they're that way, or you know, so forth, right? I think the most important thing is to listen. And my mother has told me before, she's a Blackfoot elder, and she says, the most important thing is to listen. Listen. Even if you don't agree with it and you may even think they're wrong, listen. Listen to what people have to say. Because when you listen, you learn, right? And so, and I think that's approaching Indigenous people, or your assumption of Indigenous people, with humility is most important, because a lot of our cultures, and I can't speak for all, but I can speak for my culture, you know, humility is a big factor, you know, to be humble, you know, with what we have, because, you know, we have to be humble with the nature that we are brought in to this world, you know, for.
I, Jay, I just wanted to also talk about like how do you tackle making assumptions for if a person is Indigenous or not? Like as Indigenous patient liaisons in the hospital, like not everybody will identify that is Indigenous as
Yeah,
Indigenous because of like, you know, historical trauma of like being an Indigenous person in healthcare settings. Like they don't want to be labeled a certain way, or like, you know, like people that have, you know, been told to not identify because, you know, they're going to get MCFD involved, or, you know, they're going to assume that you live a certain way. So, like, as
yeah,
Indigenous patient navigators, it was always very like, it was like up, like, it was very much like up to your kind of decision if you were going, if somebody was visibly First Nations, if you were going to go and approach them and be like, this, like, I'm here to like support you, but also like it was very awkward. Like it's definitely like a very like gray area where like, well, people don't identify because they don't want to identify in the healthcare system, but it's also like people are being asked when they enter the emergency department if they
yeah,
identify as Indigenous, but also aren't really being like, there aren't really given more information as to why they're being asked, but why they're being asked is so that they can connect with the Indigenous resources at the hospital. But like they just ask, like people will be like, they'll just like the unit clerks are being told to ask
yeah,
everybody that comes in if they're Indigenous or not, but not really like explaining why. And people are
no,
like, well, why are they asking me? I'm going to say no because I'm like scared. So then that leaves like the Indigenous patient navigators in like a really kind of funny situation where you're just like, that person's visibly First Nations, but they're not on my list. Like, should I approach them? Is it going to cause more, you know, trauma? Am I going to trigger them? It's definitely like a situation that, like, you know, what like Jay and I have been in it multiple times, and it's always like,
mhm.
oh God, I don't know. Like, they didn't identify, like, I don't want to, like, you
So
know,
I think for let's put ourselves in a position of a person that is non-Indigenous. So when, and I'm sure, and I'm not accusing anybody, but I'm sure they've had assumptions of Indigenous people and are you Indigenous or not Indigenous? I think the more that they learn about Indigenous cultures from different areas and engage with Indigenous people, that they won't have to come to all the time and assume this and that about Indigenous people. If they learn from the right sources about the ways of being and doing of Indigenous cultures and their protocols, I really think that sometimes they don't have to assume, right? I mean, they can ask, like, oh, so as you know, where are you from? Those are some of the first things Indigenous people say to each other. Where are you from? Oh, I'm from here and that. And they explain who their people are, what what their nation is. And that's a good thing because that's how we connect as Indigenous people. So how the question maybe should be, how would we dismantle assumptions of Indigenous people, right? How would we, as non-Indigenous, because these are the people that we're trying to reconcile with, right? Within the healthcare system, right? So how, as an Indigenous person, I know how I feel, as towards another Indigenous person. And when you meet them, right? Whatever there is going on with them, right? You're going to interact with them and they're going to know who you are and you're going to know who they are as Indigenous people just by looking at each other. I've often said that, right? When you're immersed in the culture, you know that. Other than that, then if you're non-Indigenous, then the thing is to learn cultural safety practice through Indigenous sources. Take the time. If this is important, then you'll take the time, like we take the time to learn about non-Indigenous things every day of our lives. The other part of it is the resources that people can mention. Well, there's numerous resources out there in regards to Indigenous literature by Indigenous authors, in regards to cultures and ways of being and doing cultural safety practices. What tools or tips that future biomedical or medical students can bring to the cultural practice moving forward to provide cultural safe care. I think that when we did a seminar there, or a presentation there at UBC, it was with medical students. They weren't, I don't know, some of them were.
The
Yeah,
23-24, Jay. That was like
yeah.
super, super, super important. I loved doing that. I thought
Yeah.
it was so
It was
interesting.
So that was it was really, really poignant for me because it gave me the opportunity to teach them how to approach Indigenous folks. And the tips are right back to the first point of this question is never assume. Never have any assumptions or stereotypes about Indigenous people because they are so much more than that. And that's really a product of colonization and the residential school situation we've had. So whatever assumptions you have about Indigenous people, you must put them aside and be open-minded to learn, to listen, and not always want to be in control of the situation. Because Indigenous people, we knew as Indigenous people before the Europeans came, and my great aunt, who lived to about over 100 years old, we're not sure actually how, but she was over 100 years old, used to tell my uncle that, you can't change the weather. So which means you can't control the situation, right? So and that's coming from an elder, a Blackfoot elder that grew up when there was no non-Indigenous people around. And she did say that. She said, you can't control the weather. So how are you going to control the way people think and do? That's just it's insidious, that behavior. So when you're speaking with Indigenous folks, you have to let them be who they are and listen to their teachings. And this will, in some respects, allow you to not have the assumptions about Indigenous folks, but it's listening and learning and having the resources through Indigenous folk. I think that's the most effective way that a medical bio student or medical student could move forward.
Thank you,
Yeah,
Jay.
so
Sorry, I was just gonna add, we have a couple of resources that some participants have been posting in the chat. So there's a toolkit. So if you guys want to check out those, it's in the chat. And we'll pass it
Sure.
down.
yeah, so I'm gonna come at it a little bit more from the biomedical engineering side, so a lot more of the medical design. And I think a bigger part of like tools or tips as we're moving through that is a lot of focus in engineering and design is on optimization and making sure what you're designing or creating is going to fit in with what currently exists. And a bigger focus has shifted more towards inclusive design, which is making sure that the product is going to work for the most amount of people possible. And I think we need to find some sort of balance as the biomedical and medical students that are on more of the designing side in making sure that we're optimizing something that's going to work for more people. So rather than making something that can easily be incorporated now, making sure that it's going to be a more long-term solution that's going to help more people in the end. So when we're going through this design process, it sort of brings us back to the other question from earlier that we were talking about, which is how we prioritize different like people's experience within healthcare. So I think it's bringing more of those voices in at a more earlier stage, like within stakeholders and more Indigenous peoples, so that instead of simply optimizing for our best solution, we're optimizing for the most amount of people and making sure that this is as inclusive as we can be. And if that requires multiple solutions, not only funding one, but going through the other avenues to make sure that we still have options for others. So I think a lot of the providing culturally safe care as we move through biomedical and medical practices really involves reconnecting with other people, creating a space, and then looking at different practices that already exist that they use, because those are often things that can be incorporated into our own practices and work. For the last question, I think they mostly covered it, but my basis for this is you shouldn't necessarily always just be going up to people and asking whether they self-identify or not, because regardless, they might have a different way of having culturally safe care. Not everybody has the same practices or will necessarily want the same level of care in terms of the cultural side. So being able to talk with them about what they would like incorporated into their care, I think is valuable in that sense. I agree with the never making assumptions here.
Carmen, do you have anything else to add to these questions?
So, yeah, just basically going off kind of like UBC is like doing their part in the reconciliation process by implementing the 23-24. I believe it is mandatory for first year medical students and last year. Do you know, Serene?
Sorry, can you?
I don't know. Pardon?
Can you repeat your question?
Oh, I was just asking, I believe that UBC 23-24 is mandatory for first year healthcare students and last year healthcare students.
I don't remember what years it is, but every student that's in like the healthcare studies or whatever, I think they have to take it. So I don't remember.
Yeah.
Like nursing, medicine, dentistry.
Yeah. So people that are like entering the healthcare fields like should like are like UBC is teaching that, but which is like great. But yeah, what are some tools?
Yeah.
But as far as that, just doing like the Sansa, I believe that's how you pronounce it, Sansa training. online, but these are things that like you
Sanya,
have to find. Sanya, is that how you spell it? Is that
Sanya,
how you say
yeah,
it?
Sanya.
I was calling it Sansa. I butchered it. I butchered it. I'm not surprised. Um, but yeah, basically, you know, people that are going into healthcare should be doing their own research as to like, you know, what they can do to reconcile with Indigenous people.
Great. That was it for our like prompt questions, but some of the questions we have in the chat are trying to find one that relates to what we were just talking to. So one question kind of going back to cultural safety is how can we plan or prepare to provide culturally safe care? Like what sort of examples do you guys have or can think of right now?
Sorry, repeat the question.
Yep. How can we plan or prepare to provide culturally safe care?
Okay.
I thought you were going to answer.
I was thinking about it, and then I was thinking that if you wanted to answer, I'll just go off what you're saying.
Well,
I don't know
as
this answer
I mean,
because
as an Indigenous person, when I approach another Indigenous person, um, I somehow, in some ways, can relate to their experience, whatever that may be. I think that question would be like culturally safe care is always, it's nothing you can really, I would say it's nothing really that you can prepare for. You're just, it's the action around it. It's the action of cultural safety. It's part of who you are as an Indigenous person when you're approaching another Indigenous person. I mean, I think that question would be more, I mean, I don't want to take away from the question, but I think that would be um, more geared towards a non-Indigenous person because as an
that's
Indigenous
what I
person,
thought. Mhm.
because an Indigenous person, I mean, you don't, it sounds like to me, it's like, how do I study for, a test almost? It's like, it's like cultural safety is what you would learn while engaging with Indigenous people. Because it's about people. It's about your experience with Indigenous people. When you get to learn who they are, where they're from, and their ways of being and doing, then you'll see the cultural safety would fall in place. I mean, of course, you'd have to have um, a framework in regards to what cultural safety is. How do I approach an Indigenous person? But for myself, it's always has to be the ways of doing and being, and that comes naturally to me.
Yeah, but it's also like that question's so broad based on like
Yeah, it is.
who's asking, and like it's also very different for each Indigenous person. Like
Yeah.
like, you know, like it's just honestly so like you can answer that so many different ways, but to be culturally safe, you know,
The
like
concept of, I believe, yeah, go ahead.
like in most healthcare settings, you try and be culturally safe with like everybody. So I'm not sure like what specifically they're asking. Jay, Emily, I don't know.
Well, it is quite broad. I mean, but it sounds like a question from a non-Indigenous person. I mean, I like never assume, but yeah, I mean, I culturally safe would be what's a good example. Um, showing an Indigenous patient that they're welcome and that their health care is just as important as anybody else's. I know for a fact that when patients come from isolated remote communities and they come to the hospital, it is like a cultural shock. So how do we culturally safely approach that person? Well, for myself, as an Indigenous person, I wouldn't think of it that way. I would think of it, maybe a non-Indigenous person would think of it, how do I culturally approach this person safely, right? Well, it's not something you test for, it's something you know about. And if you study the cultural safety literature made and published by Indigenous folks, and you adopt that into your profession, I think that's something that you can marry with your values, your ways of doing and being. I think you know, when making that person that's from an isolated community feel welcome and that they belong, I think is the first and foremost most important thing. I mean, because it is a culture shock to them. They come from a place where, you know, they're in the wilderness. Maybe someone is, you know, Telegraph Creek up north, or you know, somewhere in Fort St. John or Fort Nelson, you know, they never been down here before. So addressing them in a culturally safe way would probably be, you know, how would you prepare? Welcome them. If they're from there, so what culture is that? That's Deneza, Deneta, Cree, and some Soto. So what are the traditions around that? You would welcome them.
Thank you,
You
Jay.
know, yeah.
Just in respect to other questions, we're just gonna get on to the next one.
Yeah.
So our next question is, what is your experience with support from leadership versus frontline staff? Is there a difference in your reception you receive between leadership and frontline?
Leadership meaning like who, which in leadership, like higher ups?
Yes.
Okay, so the difference between like people that are making the policies and procedures and the frontline people?
Yes.
Okay. Well, I mean, I think in theory, everyone thinks their policies are going to work, but when it's like frontline to frontline, it's like not that, it doesn't compute that easily. Frontline staff are being told, you know, like, I think all of us have experienced a grumpy frontline staffer, you know, like where you're just like, yikes, like that person's not being culturally safe. But yeah, at the same time, like their leadership has been like, oh, they've taken this training, they've taken that training. So like being an Indigenous patient liaison, like you actually have like you're basically just an advocate. So like a lot of the people on our team, Jay, are like very good at being like, look, like this isn't great. Like we need to like talk about what's going on. Like, you know, this person isn't feeling safe. Like, what are you gonna do about it? And does that kind of answer the question?
Yeah, I think so.
But like leadership always, like I find that by the time, like I think that leadership always thinks in a sense that they know what's best for certain communities, or like honestly like they're writing so many things that you think are going to work so well but like put into practice on frontline staff with like a super marginalized community, like this doesn't like it doesn't happen that like flowy. But I always find there is a bit of a
Disconnect.
like, pardon?
Like a disconnect between.
Oh yeah, there's always a huge disconnect for sure. What do you think, Jay?
Can you read the question again, please?
Sorry, I have to find the question again.
Sorry.
That's okay. I just scrolled past it, that's why. What is your experience with support from leadership versus frontline staff? Is there a difference in reception you receive?
Very much so. Very much so. You know, I don't want to beat up on the higher uppers or anything like that. Certainly not. But I believe that they have a job and a mandate to do, right, in regards to what is put in front of them in regards to policy and procedure. Well, obviously, most people that work frontline, they know that there's going to be a disconnect. Um, in regards to Indigenous folks, like Carmen was saying, they feel that they know, usually what would be good for them, what would be good for them. But when I look at it like that, I think that's just another form of colonialism, and this construct of the colonial um, uh, design of our healthcare system. So I think that at the top, I think there needs to be more collaboration with people that have experienced racism, the marginalized. And how would we do that? How would we do that? More meetings like this, more seminars like this, but engaging with the people that are marginalized, the communities that are marginalized, and telling people that we know what's better for you is what we want to get away from. And if it means writing the policies that are going to work for people and the Indigenous people that we work with, I think there has to be much more engagement, because a lot, and I'm not going to assume, never assume, but a lot of the higher uppers there, I don't know if they have the experiences working the front line. Maybe they do, maybe they don't. But if they were to work the front lines in the downtown east side and understand exactly where people are at, like meeting them where they're at in policy is so important. And how do we mitigate the risks around that? How do we make it more streamlined within policy? That's how it's going to work. I would think it would work much more effectively. But when there's this big disconnect, and it just continues to be the same of more and more of what it is. So I think more collaboration with all levels, with marginalized Indigenous communities,
Thank you, Jay.
peoples of, yeah. So, yeah.
Emily, do you have anything to add to that question?
I don't think anything right now. This isn't quite my field of expertise, so I'm sure Jay and Carmen have covered it quite well. I think the only thing that I could add on was probably from the previous question when we were talking about that preparation side. And I think a big part of that is really just education and knowledge and taking the time to learn on your own end, because you're not always going to have people that are there when it comes to planning and preparing. Planning, it's logistics as always, but preparing is really just making sure that you have that background going into different situations. And the only way you get that is from going out and educating yourself as well.
Mm-hmm.
All right, thank you. Thank you for adding to that. And our next question is, given the great diversity of Indigenous peoples in Canada, how do you support different protocols, patients, and family requests? Emily, did you want to start this one? Like if you were in the front line or working field?
So do you want to repeat the question, please?
Yep. Given the great diversity of Indigenous peoples in Canada, how would you support different protocols, patients, and family requests?
Yeah, well, it's a really good question. I think an important part is the location that you're in Canada. I think the great diversity of like Turtle Island, and when we're talking about Canada specifically, is that we do have nations that are all over. So making sure that the policies and protocols that you're using within your own hospitals are reflective of the people that are there. I wouldn't necessarily take like Ojibwe practices and then come to Vancouver, because there might be some similarities, but regardless, you're still going to have differences in cultural practices that will need to be included, or different medicines that will be needed. So yeah, I think making sure that you're collaborating with people from where you are currently from, and then also doing the research to find out which peoples you're caring for in that region. Without having that knowledge, you're not going to be able to cater to the different cultures that are there. And so making sure you're taking those steps to find out who you're caring for and what their needs are, and listening to those people, I think really helps you set up those protocols. I don't know if Jay or Carmen want to add to that.
Excuse me, but to add to that, Emily, I would say that there's a lot. I hope I don't lose my train of thought here. Um, there's a lot of non-Indigenous people that just think Indigenous cultures are all the same. I don't know how many times, countless times oh, I didn't know that. I'll tell them about something. Oh, I thought it was the same from BC to Ontario or BC to Alberta. No, it's totally different. Like the West Coast, they're potlatch people. The Plains, they're Sundance people. The cultures are totally different. The people are even physically look different. So these are the things they've got to learn about where they are, who, and those are the things that are important in regards to cultural safety to Indigenous folk. When you know who they are, where they're from, and you can empathize with their culture, that is called and engage with them on their level of their culture. That's cultural safety in action, if you will, because it's important to understand people where they come from and where they're at in their lives, right? You can do that. I mean, that doesn't take a rocket scientist to understand that. It's like anywhere else. It's like French from France and Quebecois French from Montreal. So it's not all, it's French, but it's not all, it's same with us, with the Indigenous folks. And when the people take the time to learn and understand and incorporate the local culture, a good example is I'm from Treaty 6 territory in Alberta. This is why it's so important to give acknowledgement to where we work and play in regards to the 3 host nations, because that opens the door to tell them, we're here, we're willing to learn about your culture and be there. I think that's important. And this is what key to cultural safety will be, is when they learn the intricacies of the cultures of where they are and where they're situated, and also other cultures. When we work in the hospital, we have people from all over. So we have someone, does anybody speak Cree? Or does anybody understand Cree? Well, I'm Plains Cree. So they want to speak to someone that's Cree. Is someone Dene? So we used to have one that was Dene. She's no longer there, but or Nishka. So this is how we would approach it. This gives them a sense of belonging and being at home. That's cultural safety in action. Does that answer the question?
Yep, thank you, Jay. Carmen, do you have anything else to add?
No, I don't think so. I think that Jay and Emily did a great job at answering that, and I'm also being mindful of time.
Thank you.
Is it over at noon or supposed to be?
Yeah, so I was just gonna ask if you guys have any closing remarks. If you want to share any closing words or any take-home messages for everyone. Do you want to start with Carmen?
Honestly, I don't really have anything to add. I think that these opportunities to chime in and, ask questions and, join these learning circles and just like continue to want to further education and understanding Indigenous peoples is like the best way to, towards reconciliation.
Thank you, Carmen. Emily, do you have anything to add? Any take-home messages?
Mostly just to keep learning. I think everybody's doing a great job by already coming to this seminar, which is already a great step, but taking that time to learn from Indigenous peoples. I mean, UBC has the largest library of Indigenous works in all of Canada, if you guys didn't know. So we have a library on campus that you can go to, which is always really cool. But yeah, just making sure that you keep learning and learning from Indigenous peoples in particular.
Any last remarks, Jay?
The one thing I would say is more or less what Emily said. I'll piggyback what she's kind of said, is that the non-Indigenous peoples of Canada, to continue to learn from Indigenous folk, learn from our elders of our ways of being and doing. And this will promote cultural safety through the more you know of the Indigenous peoples in Canada, the better you're off you'll be when it comes to cultural safety. And thank you to everybody. It was my
Yeah,
honor.
thank you.
Thank you. And yes, thank you to all our guests and for everyone for joining us today. Thank you so much, Emily, Carmen, Jay, for the amazing discussion. It was great to learn about your guys' experience working in the healthcare field, but also as a student in the healthcare field. It's so important to hear your guys' input on how to provide culturally safe care, but also you're sharing your own experience. And thank you for that. And just before we end the webinar, we'd love to bring your attention to our upcoming learning circles. We have Peace of Mind for Rural Maternity in BC with real-time virtual supports. That's on March 28th. And then we have Walking Like a Warrior, Introduction to Self-Defense on April 2nd. And then we have Unseated and Undefeated with Alana Cook. That's on April 16th. And in Trauma-Informed Healing Centered Community Wellness on April 17th. All of our webinars are free to sign up for on our website at www.learningscircle.ubc.ca. Sign up for our newsletter. The link will be in the chat. And thank you, everyone, for joining us today. We look forward to seeing everyone at our next Learning Circle. Lim Lim, thank you.